After years of hesitancy, Melanie Hill now not only gets her flu shot every year, but encourages her friends and family to do the same.
I just talked about my experience with it with them, and I try to offset any type of myths that I hear or misinformation that I've heard.
Melanie felt comfortable getting her shot thanks to the efforts of healthcare providers like Nate Royster, an emergency nurse at the Ohio State University Wexner Medical Center. Regardless of what brings patients in, he makes a point to ask about vaccines and takes the time to listen to their concerns.
We just have to work with those beliefs and try to change them without offending that patient and making them feel belittled.
It's part of a new initiative to close racial disparities in healthcare, starting with flu shots. According to the CDC, although 53% of the white population were vaccinated last flu season, just 38% of Hispanics and 41% of the black population received their shots.
Immunization is our best defense against influenza, and we wanted to make sure all the communities we serve were equally protected.
They started by securing extra vaccines and prompting nurses to offer them to every patient in every clinical location, so they receive the information where they're comfortable receiving care, whether that's the emergency department, a primary care office, or a specialty clinic. Nurses also called people in targeted zip codes where vaccination rates are low. These efforts apply far beyond flu shots to disparities in routine screenings for diabetes and cancer, and especially for COVID vaccines, which are critical to public health yet carry a lot of skepticism.
We can't just have a streamlined way of educating them. We just have to understand their education, their background, their socioeconomic status, access to health care, and their skin color, religion. All those things all play a factor.
This approach is already making an impact. At Ohio State, emergency nurses administered 10 times more flu shots to non-white patients by March of 2021 than all of the previous year.
Unless you actively look for these disparity issues and then come up with very transparent ways of addressing them, it will always be there. And so this is a step towards improving that.
At the Ohio State Wexner Medical Center, this is Barb Consiglio reporting.